Hello, head, if everything you've been told about preventive health is a lie? What if your dedication to staying on top of your health is actually leading you down a path of unnecessary panic, risky procedures, and life-altering side effects? Asterisk 5 health checkups you should avoid after 50 that may harm you more than help. There's a silent epidemic in modern medicine, one your doctor won't warn you about. Every year, millions of healthy adults walk into clinics for routine checkups, believing they're doing the responsible thing. But new, shocking data reveals that for people over 50, some of the most common tests are a gateway to overdiagnosis, harmful treatments, and even new diseases. Studies now show that up to 40% of medical screenings in healthy middle-aged adults lead to false alarms, unnecessary treatments, or lifelong complications. And the most terrifying part? 99% of people have no idea they're being set up for a medical domino effect that starts with a simple, seemingly harmless scan, one test on this list, on number 1. It's so overused that it's now responsible for a staggering percentage of preventable medical harm in this age group, putting it on par with some of the most significant public health concerns. You won't see this on a morning show. Your clinic certainly won't tell you. But the evidence is buried in medical journals, and today, we're pulling back the curtain knot in this video of 5 health checkups you must question after 50 and a terrifying truth about what they can do to your body. All backed by real science, and you won't believe what made it to number 2 before we begin. Let us know in the comments below. Where are you watching from? How old are you? And have you ever regretted a test or procedure? Do you think we are tested too much? We're reading and replying to every single comment with personalized tips and advice. And don't forget to like this video and subscribe to our channel for more truth you deserve to know right now. Let's dive in. Let's talk about the first test. Well, it looks like a smart choice, but could secretly steal your quality of life. At number 5, the annual executive blood panel. That it sounds so comprehensive. A single blood draw that checks for hundreds of potential issues. You walk out feeling in control. But here's what they don't tell you. For a healthy adult over 50, this massive fishing expedition often catches problems that aren't really problems. Slightly off markers for liver enzymes, borderline thyroid levels, or a minor vitamin deficiency can trigger a cascade of anxiety, repeat testing, and referrals to specialists for conditions that would have resolved on their own. You end up treating lab numbers, not a patient. The stress and medical visits from chasing these false flags can be more damaging to your health than the benign, age-related shifts the test detected. Often, a simpler, targeted test based on your actual symptoms is far wiser and less frightening. Number 4, the full spine MRI for back pain says we age our backs ache. It's a fact of life. So when that dull pain flares up, the impulse is to find the cause. Doctors often order an MRI to be thorough. But here's the uncomfortable truth. MRIs of the spine in people over 50 almost always show abnormalities, bulging discs, minor arthritis. Spinal stenosis, these are as normal as gray hair after 50. But seeing these findings on a report can transform normal aging into a terrifying diagnosis. It leads to fear of movement, unnecessary physical therapy for a severe issue, and even surgeries that have notoriously mixed results for non-specific back pain. Studies show that the vast majority of these findings are not the true cause of pain. Often, the best medicine is targeted exercise time, and avoiding the scan that will likely show something scary but irrelevant. Number 3, the nuclear stress test for ambiguous symptoms. You feel a bit more tired than usual. Maybe you get short of breath gardening. Your doctor, wanting to be safe, orders a cardiac stress test. But after 50, this test can be a fast track to procedures you don't need. The problem is the high rate of false positives. The test can suggest a blockage where none exists, leading to an angiogram and invasive procedure where a catheter is threaded into your heart. This can result in unnecessary stents being placed, which come with risks of bleeding, blood clots, and kidney damage from the contrast dye. For vague symptoms without clear chest pain, the risks of the diagnostic cascade often far outweigh the benefits. A simple discussion of risk factors and perhaps a calcium score scan can be a much safer first step at number 2. The annual whole-body skin cancer screening. You're told to be vigilant about your skin. So you see a dermatologist every year for a full-body mole check. It sounds prudent, but for the average person without major risk factors, fair skin, family history, many moles, this can lead to a high rate of overdiagnosis. Many harmless, atypical moles are biopsied just in case. These biopsies can leave scars and cause significant anxiety. Worse, the aggressive treatment of very early-stage melanomas that would never have actually harmed you in your lifetime is now a recognized problem. The psychological and physical toll of this overscreening can be significant. A better approach is monthly self-exams and seeing a doctor only for a spot that changes, itches, or bleeds the ugly duckling that stands out from the rest. And now, the most overused, most dangerous, and most harmful checkup for adults over 50. Number 1. The routine annual chest CT scan, marketed directly to consumers as the ultimate peace of mind. Full body or chest CT scans are the worst offender. These scans bombard your body with ionizing radiation, the same kind that causes cancer. For a healthy 50-year-old, this radiation exposure accumulates over time, increasing lifetime cancer risk. But the real harm is in the findings. These incredibly sensitive scans will inevitably find incidentalomas, tiny nodules, shadows, or spots that are almost always benign. But once seen, they cannot be unseen. This triggers a relentless cycle of follow-up CT scans every 6 to 12 months, each delivering more radiation, along with immense anxiety and sometimes even invasive lung biopsies for nodules that were never a threat. The risk of harm from the follow-up process is far greater than the minuscule chance of finding a real, treatable cancer early. Major medical societies unanimously recommend against these scans for asymptomatic people without specific risk factors. They are a solution in search of a problem, and they create new ones in the process, so there you have it. 5 checkups that may seem helpful but can actually hurt, especially once you're past 50. Modern medicine is powerful, but it's not perfect. Sometimes less is more. Always ask your doctor, what happens next if this test finds something? If the answer is unclear, or if the risks of the follow-up are higher than the reward, it may be time to pause. And remember, real prevention starts with lifestyle. Stay active, eat well, sleep deeply, and choose your checkups wisely. Now, we want to hear from you. Have you or someone you love ever faced complications from a medical test or treatment that turned out to be unnecessary? What happened? Share with us your experiences and opinions in the comments below. We'd love to hear them, and thanks for watching.